So we've talked about our forage management plan, we've talked about our breeding and calving season plan. Another plan we need to think about for our operation is our herd health plan. And so when we think about herd health, there's a lot of things to consider there. And the big thing is we want to try to prevent as many illnesses as possible. And so to do that, one thing we'll use is a vaccination program. So when we talk about diseases that are routinely vaccinated for in beef cattle operations, one thing we'll talk about is our clostridial diseases, all right? And so that would be what a lot of people would refer to as a 7-way or an 8-way blackleg vaccine. Realize blackleg is only one component of that clostridial vaccine. And so we would have that. Another group of diseases or pathogens that we're going to vaccinate again is what we'd call our viral respiratory pathogens. And so those would be IBR, BVD, PI3, and BRSV. You can kind of think about that being similar to a cold or a flu in people. Instead of being bacterial, these are going to be viral organisms. And then from a reproductive standpoint, we want to think about lepto and vibrio. And so just quickly from a calf side of things, we would typically give a clostridial vaccine. We would give that viral respiratory component. And then I like to use a lepto vaccine. And for our example here, we would do that as well. If we get into some spots of the Panhandle or West Texas, that may not be as critical. And you may be thinking, Jason, I thought lepto was a reproductive disease, and it is, but the reason we want to give it to calves is if they get lepto, it can actually kill them. Now, if we catch them early enough, we can treat it, but it's good in my mind to just go ahead and prevent that. When we think about our replacement heifers, our cow herd, then again, we're going to give them that 7 or 8-way clostridial vaccine. And I realize that cows don't get blackleg, but they do get some other clostridial organisms. The other thing, by vaccinating those cows, we can increase the antibodies in their colostrum that's going to get passed on to that newborn calf. So when calves are born, they actually don't have a functioning immune system. They get all their initial immunity through that colostrum, which is going to be that first milking within the first 24 to 36 hours. Now, ideally, we want those calves nursing within the first 8 to 12 hours, but they'll continue to get some colostrum that first 24 to 36 hours. So that's when we think about that clostridial vaccine for those cows. The viral respiratory vaccine, we for sure want to make sure we give those females IBR and BVD, because in addition to causing respiratory issues, both of those two pathogens can cause abortions as well in our cow herd. If you want to use BRSV and PI3, that's fine. That's what most people will do, just because most of the vaccine that we buy, that's the way it's going to be packaged, is with those 4 components together. Then we're going to give those cows lepto, like we talked about, from a abortion and a reproduction situation. And then depending on your operation, you may want to use vibrio as well, which is a venereal disease that can cause abortions as well. The main thing when we think about vaccination in our cow herd and preventative herd health is one vaccination program does not fit all operations. So you want to make sure you find a local large animal veterinarian and work with them to customize a vaccination program for your operation. The key being a large animal veterinarian. So that may be somebody different than you take your dogs or cats to. You want to work with a veterinarian that deals with cattle on a regular basis. When will we typically give these vaccines? So if we're talking about calves, most people like to get the first round of vaccines in those calves at 2 to 3 months of age. So at that point in time, we'd give that 7 or 8-way clostridial vaccine, viral vaccine, the IBR, the BVD, the PI3, the BRSV, and then if you choose to give lepto at that point in time. And then if those calves have never been vaccinated before, like they would be in this situation, we're using what we call killed vaccines, all right? And so why that's important is is the immune system needs to see those vaccines and then build a response to them. And so if cattle have never been vaccinated with a particular, for a particular pathogen before, we need to give 2 doses initially. So we would give that first dose, and then you could come back and give that second dose 4 to 6 weeks later. Or what a lot of people will do is a few weeks pre-weaning or a week or 2 post-weaning, they will give that second dose. So in our operation, for example, ranch here in College Station, we're going to do it at 2 to 3 months of age, and then we're going to give that second dose a few weeks before weaning. When we think about timing of the vaccine for the cow herd, we have a little bit of flexibility there. The Clostridial vaccine, ideally, we would want to give that sometime pre-calving because it can increase those antibodies in that colostrum a little bit more. But in reality, the thing we're going to focus on more is those vaccines that will help prevent abortions from those pathogens like IBR, BVD, Lepto, and Vibrio. And so for those, typically we want to look at giving those pre-breeding. If you want to go ahead and give your Clostridial vaccine at that point in time, that's fine. That's what a lot of operations will do. And so the calves, 2 rounds initially, and then if we're keeping replacement heifers like this situation, we would continue to give 1 round every year with our cow herd, 1 round of vaccine annually. But again, make sure you work with your local large animal veterinarian to customize a program for your operation. So when we think about our herd health program, and we talked about some of the vaccines that were important to prevent abortions in cows, we need to talk about a disease like trick, that even though there's a vaccine on the market, the vaccine doesn't prevent those animals from getting infected. So if you've never heard of trick, what it is a protozoal parasite that's transmitted through breeding activity. That's the only way it can get transmitted from animal to animal. So if we have an infected cow, a bull breeds her, he gets infected, he can spread it throughout the rest of the herd. Or if he's infected, he can spread it to cows who have never been exposed before. So the key when we think about herd health with something like trick is to make sure we don't bring it into our herd. And so we want to make sure we're buying bulls. If they're not virgin bulls, they have to be tested according to regulations in the state of Texas. So just make sure those regulations have been followed if those animals are over a certain age. And then on cows, we just want to make sure we buy cows with a known reproductive history, because buying cows with the unknown history can bring a lot of risk into our operation. And so the way we manage trick is through biosecurity. We just want to make sure we don't bring that into our operation. The reason we worry about it is we would want to have pregnancy rates in our herd that are, say, 90 to 92%. With trick, we can have so many abortions that we decrease those pregnancy rates down to 40 or 50%. And so that can drastically wreck an operation and the success of a cow-calf operation. Another part of that herd health plan is internal parasite control. That's going to vary tremendously depending on where we are. So going back to that production environment that we started off with earlier in our discussion. And so here in Central Texas or East Texas, we typically need to look at deworming those cows twice a year. And what's going to influence that is the amount of rain. Higher rainfall areas makes a better environment for those internal parasites, and so we want to treat more. When we get into lower rainfall environments, once a year may be fine, or we may not have to deworm at all depending on the situation. But for example here, the most important time would be make sure we get dewormer in those cows so that we have active ingredient that can control parasites during June or July. So depending on what product we use will depend on the timing. But the reason we're worried about June or July is the parasite that we're primarily worried about is Ostritergia ostritergii. That parasite is transmitted during the cooler portions of the year, and the way it makes it through the hot, dry summer is inside the digestive tract of our cows. And so we want to make sure we treat when it gets warm, or excuse me, we want to make sure we treat when it gets hot and dry, so that we can kill those parasites and then we reduce the numbers out on the pasture. And so if we're using a product that has 28 to 42 days of residual on it, we can move back into late May and treat those cows. If we're using a product that doesn't have any residual on it, then we need to be in June or early July. If we're using a product, there's one injectable product on the market at the current time that has 120 day and in some situations 150 day residual control or persistent activity of that product, and we could back up into March or April for using that. The key is to have something in that animal June or July. We also want to come back and in this environment deworm those cows again November, December. There's a different species of internal parasites that we're trying to control at that point in time. And so for College Station, twice a year would be a good practice for internal parasite control. June or July, November, December. So we talked about our timing of deworming and that it would vary a little bit with products. Let's just briefly talk about some of the product options from an internal parasite control standpoint. And so one group of dewormers, we have two primary groups. One group is going to be what we call the macrocytic lactones. So products that would be in that group would be Cydectin, Dectamax, Eprinex, Long Range, and Ivomec. Realize all those products are in the same chemical family. And then the other chemical family is what most of us refer to as the white products. And so that would be things like Valvacin, Synanthic, Safeguard, and Panicure. And so if you decide you want to rotate, if you go from Cydectin to Eprinex, all you're rotating is what company you're sending your money to. Both of those are in the same chemical class. To rotate, we would need to go from one of those products to one of the white products we just mentioned. Do you need to rotate? It's going to depend on who you talk to in the industry. The parasitologists that I work with the most here at College Station would say pick your product and use it because we're only deworming cattle twice a year. So I'll tell you personally, in our operation, I've used the same macrocytic lactone for the last 15 plus years. And so we're going to use that product late May, and then we're going to come back and use that product again November or December. When we're looking at those products, you want to look and think about withdrawal times. And so from a BQA or beef quality assurance standpoint, we want to make sure we don't have any residual left in that animal. And so some of our pour-on dewormers like our Cydectin or Eprinex or Dectamax or Ivomec vary in slaughter withdrawal. And so just quickly, for example, Eprinex and Cydectin don't have any slaughter withdrawal. And so if they're just as good, which in my opinion they are, as some of our other macrocytic lactones, it's nice having a product that doesn't have any slaughter withdrawal. The other thing to think about is weather. Some of our pour-on products require that we don't receive any rain within a certain period of time. Some of them we don't have to worry about it. So it's a little cloudy today. We're sitting here in December. If we're getting ready to deworm cattle, I'd be looking at one of the products that I didn't have to worry about weather concerns on. Another thing to think about is there are a couple dewormers, Ivomec and Dectamax specifically from a pour-on standpoint, that are flammable. So if you're branding from an identification standpoint, make sure you brand those animals before you pour that dewormer on, because you can actually light that animal on fire, and that's not good for anybody in this situation. The same thing can happen if you're getting way too aggressive with the hot shot. You can spark that. So that's another thing to keep in mind when we're looking at those dewormers. So I mentioned for the cow herd, maybe not needing to rotate depending on how you feel for your operation and again, working with your local veterinarian. Now, what a lot of people will do though, is especially if we think about our calves, there's a group of worms that's a problem in calves that's not a problem in cows. And that group would be the Capiria species. So once cattle get over about a year of age, that worm just doesn't cause us any problems. The reason I bring that up is those macrocytic lactones I talked about, the Cydectin, the Eprinex, the Long Range, those products have never been real good on Capiria. The white products, that white drench, that Safeguard, that Panicure, that Synanthic, that Valvicin, are really good on Capiria. In Capiria, when we think about the time they're transmitted, they're actually transmitted during our warmer months. So they're transmitted during the spring and summer. So if we have spring barn calves, our example, when we have those winter barn calves, when we wean those calves in the fall, we may want to think about using a white dewormer at that point in time to take care of that Capiria. We could use one of the other dewormers as well to give us some residual control for some of the other internal parasites. So we've talked about internal parasite control. We also want to quickly talk about external parasite control. Two of the primary external parasites that we're going to have in Texas are going to be horn flies, are going to be our primary one. And when we think about horn flies, there's a lot of control options out there, whether we're talking about sprays, we're talking about back rubbers, we're talking about ear tags. There's even feed-through products that we can feed in our loose mineral or tubs, or we could add into a textured feed. The primary one would be an IGR. That one, the brand name on that product would be Alticid. The active ingredient would be methoprene. So if you see that in your loose mineral, that's for horn fly control. It's important to realize though, that product, unlike those ear tags and those porons we talked about that kill the adults, the IGR, those adults lay eggs in manure patties. It keeps those eggs from turning into larvae and then adults. So it works best if we use an IGR in combination with some type of a topical product. It's also important when we're talking about external parasites, and specifically our flies. There's 3 species of flies that are primary problems in the state of Texas. Horn flies, which we just mentioned, stable flies, and then face flies. The horn flies, we'll find them on the backs and shoulders of our cattle. When it gets hot or real windy, they'll move down to the belly. And sometimes later into the summer or early part of the fall, you may see them down on the legs, but normally backs and shoulders. The stable fly, I'll just mention that real quickly. We'll see those down on the legs of the cattle, and then the face flies we'll see around the eyes and the nostrils. It's important to know which one you're dealing with because we're going to treat all of those differently. Why is it important to control those horn flies? If we look at stocker cattle or replacement heifers, if we look at the average across several research studies, it would show a reduction in average daily gain of 0.2 pounds a day. So every 5 days, we're losing a pound of weight gain in those cows, or excuse me, in those cattle. When we talk about nursing calves, we're looking at somewhere on average around 0.1 pound a day. So every 10 days, we're losing a pound of weight gain in those animals. And if you have higher performing animals, we actually see a greater reduction in performance in those animals. So as a recap from a herd health standpoint for our example ranch here in College Station, we would typically look at starting horn fly control sometime in March. In April, at that branding time, we're going to be looking at giving that first round of vaccines to those calves. Coming late May or June, we're going to look at deworming the cows, and we're also going to go ahead and deworm those calves at that same point in time. We can use the same product on both the cows and the calves. Then in September, we're going to look at weaning, and we would have our vaccination program a few weeks pre-weaning, or if you choose, maybe a week or 2 after weaning. And then in November, December, we're going to come back with that second dewormer. And at that point in time, we're taking care of internal parasites, but I mentioned lice. We have 2 groups of lice, biting lice and sucking lice. A good pour-on dewormer will take care of those lice with 1 treatment. If you're using another topical product, you're typically going to have to use 2 treatments. You treat them once and then wait 2 to 3 weeks and treat them again to break the life cycle for those lice.